I'm Dr. George Ansstas. I'm an oncologist here at Siteman Cancer Center, Associate Professor of Medicine at Washington University, also Clinical Director of Melanoma at Washington University. I've been actually here with WashU since 2008. And admittedly, I would tell you, back in the days, melanoma was not my special interest because these patients, unfortunately, used to die from the disease. And we used to call it a death sentence for ever get melanoma in metastatic setting. So I tried to avoid seeing these patients because it was very depressing. Fortunately, around finishing my fellowship in 2010, we started to see the early results of immune therapy. It can work in these patients. We've started to see that a drug called ipilimumab might hold about 10 to 20% response rate in these patients, but was very interesting that these patients can live for a decade. So that was unprecedented in the field of cancer in general and also in melanoma. That triggered me to really invest more in immune therapy and immune checkpoint inhibitors and made me feel like I really need to switch my path to a disease that we can cure, which was incurable in the past. And I started that journey back in 2011 when I got myself involved in many of these clinical trials that use multiple immune checkpoint inhibitors. Our own immune system, it does have brakes and accelerators. So our body, whenever we have an acceleration of our own immune system, put brakes. Actually, cancer can add more brakes into your own immune system so your own immune system cannot fight the cancer. So all what we've done with this research is to try to just break these brakes. So you have more of acceleration of your own immune system, so your own immune system can go ahead and kill the disease. We are a major force for moving the science forward. We've been part of the effort to really enforce this observation by enrolling more patients and expanding on the science of it. Most advanced stages, which is the metastatic disease, when patients have disease already spread to different organs of their body. So we feel now in the field that we might be able to cure between 40 to 50% of these patients. 12 to 14 years ago, these patients used to die within 6 to 9 months. So we feel it's really a revolutionary advancement in treating these patients. Now we have even more therapies on market that personally I feel it's probably also adding a few points to the percentage I just gave you, which is like cellular therapy, the TILs, product name lifileucel. And personally I feel probably we are around 50 to 60% of cure rate in today's practices with all the resources and tools we have in our pocket when we treat these patients. Personally, I've seen many of my patients who've lived over 10 years with no evidence of disease. So we do believe that we are curing these patients.